No, so physician associates have been really a core part of the healthcare system generally in the US for quite some time. But here in the UK and perhaps elsewhere in the world, it's perhaps a role that some of our viewers might not have encountered as yet. So just in a sort of a quick overview, what does the physician associate role kind of entail? How do you fit into the orthopedic team or any other team?
Yeah, sure. So physician associates are part of the healthcare team, and they're trained medically. So after graduating from university, physician associate students enroll in a 2-year PA program. The first year they spend learning about medicine in a classroom, and the second year they spend in hospitals and in clinical settings, still learning. After graduating, they can work with supervision under a physician, and they perform many of the same tasks that physicians do. They diagnose patients, they may order tests, and they can help design treatment plans. PAs are becoming more common in the UK, and you may start seeing them either in GP setting or even in hospitals.